Uh, Good morning. Good morning, everyone, and thank you for joining us today on this webinar on accelerating digital health outcomes with the cloud. So this is the second webinar from the ADB AWS Area Cloud Policy Series. Today, we'll be doing a deep dive into the healthcare sector. So we will start with a presentation of a report on economic benefits of the cloud-enabled healthcare by Deloitte, followed by a panel discussion exploring the potential for digital health in the region on how to increase cloud adoption and how digital health can improve health equity in the region. So without further ado, allow me to hand over to Sruthi Srikanthan, Partner, Deloitte Access Economics, and Nick Hall, Associate Director, Deloitte Access Economics, to kick things off. Thank you.
Thank you so much, Manny. I am Sruthi. I am a partner at Deloitte Access Economics, and I am actually a health economist. And so I work in our health economics and social policy group. And I am joined with my colleague, Nick, who will be speaking. And we're going to speak about this piece of work that we've been working on over the past few months of analysis. And we're looking forward to finalising it with Andrew and his team. And to that point, actually, I would now like to invite our distinguished panel to come and join me on video. We have the pleasure today of hearing from some experts on this topic, and hopefully this discussion will help bring to light some of the research that Nick has just been presenting. So I might just quickly provide a one-line introduction of our panelists and allow them to extend on that. But just so that you know who we're speaking to today, we have Andrew Wiltshire, who is from AWS and has been the person that we've worked very closely with on this piece of work. He's a globally experienced senior executive with deep experience and expertise in health care, business leadership and government relations, market access and external affairs. Dr. Antonio Villanueva, who is from the Economic Research Institute for ASEAN and East Asia. Dr. Anton is ERIA's Senior Advisor on Healthcare Policy for Clinical Trials and Health Development. He is also a family infectious disease physician with a background in pandemics, clinical trials and public international health and law. We have Dr. Eduardo Bazun from the National University of Singapore, who is a principal health specialist in the Southeast Asia Regional Department of the Asian Development Bank and an honorary visiting associate professor in the National University of Singapore, Hock School of Public Health. Setaji from the Ministry of Health in Indonesia, who is experienced in the development of smart city and digital transformation in government. And we also have Sevan Misra, who is from Access Health International and leads consulting and research projects on health technology innovation, health financing and service model transformation. I am actually just going to ask if we can please have our panelists each introduce themselves over and above what I have just provided. And I'm so sorry, I should also mention that I read out a name that is actually not able to be here today. Setaji is actually not able to be with us, so I should have looked at the screen and not at my notes. But if I could actually just start with maybe Andrew, I might get you to just introduce yourself. And even while you're introducing yourself, if you could also add what you believe is your vision for cloud in healthcare over the next 5 to 10 years, that would be a wonderful start. Andrew.
Great. Thank you very much, Sruthi. And I don't have a lot extra to add about myself. I've been with AWS about 2 years working in our regional healthcare policy role, supporting our teams around the region, and have had the great pleasure of interacting with a range of healthcare experts and governments around the region in that role. Prior to that, I worked primarily in medical devices and medical technology in health economics and market access and government relations. So that's kind of my background. In terms of my vision, look, I think we're just at the beginning of a really exciting journey in digital health, and particularly cloud-enabled digital health. What we're seeing in terms of the ability to rapidly speed up development of new therapeutics, vaccines, by the use of the power that comes in computing behind cloud. The example that we've seen with Moderna being able to identify the target for their vaccine in 2 days by using the power of cloud computing. The things that we're seeing in terms of genomics and personalized medicine is really exciting. And again, being able to use data at that scale, or share, store, transfer data at that scale has been a real game changer on that. And also being able to build platforms that enable federated research, so the data stays where it belongs, but people can research with it around the whole world. Take the information away, but leave the data where it originated is really interesting and exciting. And I think for me also, being able to address some of the equity challenges in healthcare. Nick and Sruthi both kind of referred to that, but resources in healthcare are really constrained at the moment globally. Trained clinicians are in very short supply, and we've got lots of rapidly developing parts of the world where demand for healthcare and improved healthcare is at all-time high levels, and certainly COVID accelerated that as well. So the ability to be able to take care to people where they are, to expand the capacity of the trained clinicians that we've got, helping them to work at the top of their license, and taking some of the administrative burden away from them is really exciting opportunities. So I'll stop there, and we can have a discussion on that afterwards.
That's fantastic. Thank you, Andrew, and thank you for setting that up. I actually was now hoping, Samin, could you please introduce yourself and also answer the question from your perspective of the potential for cloud in healthcare?
Hi, everyone. I'm Samin Mirza. I'm a senior strategy consultant at Access Health. Access Health is a think tank and advisory firm. And our vision is that everyone, no matter where they live or what their age is, should have access to high quality, affordable healthcare. And that actually ties in with what I see as the vision for cloud in 5 to 10 years. It might be perhaps too much to expect, but stealing a line from the Digital Impact Alliance, the cloud would give us universal digital coverage, and universal digital coverage will give us universal health coverage. So that's my vision.
That's beautifully put. Thank you so much, Samin. Dr. Anton Villanueva, may I get you to introduce yourself, please?
Good morning. I'm happy to be here. Please call me Anton. The healthcare unit of ERIA, we have been focusing, of course, for the past few years on COVID projects and universal healthcare, as well as digitalization. So absolutely, this conference is very, very relevant, and I am excited to share about our experiences, our findings on the operationability or functionality, how to carry it out, and hopefully everyone can be able to share their comments, experiences about this as well. Thank you very much.
Thank you so much, Anton. And I think, Eduardo, if I could please ask you to come off mute and introduce yourself as well. Thank you.
Thanks, Shruti. So, call me Dodo Bazon. I'm Principal Health Specialist in the Southeast Asian Regional Department of ADB. And so we have been supporting countries in Southeast Asia, developing member countries in Southeast Asia, pursue universal healthcare, implement health reforms, respond to COVID. And I think among the points we would like to raise later when we talk about the cloud is that there are interventions or that in a sense, countries, everybody globally have accepted to be key parts, key interventions in pushing universal healthcare, strengthening primary care, utilizing, harnessing community health workers, having strong purchasers, national health insurance agencies, and in a sense, cloud, as shown by Nick Hall in his presentation, would actually, for me, I think would enable us in doing things, in pushing primary care, empowering community health workers, and strengthening health purchasers like no other. When we talk about health purchasers, health insurance, that's data heavy, unbelievably data heavy, and a lot of government has been running it. And if you could incorporate cloud computing in that work, you could just imagine how well it would be. Imagine community health workers where they will become empowered because the cloud will give them tools. Right now, as Jeremy Lin of NUS said before, they walk around with just 2 syringes, a little bag, and all that. Now you could give them smartphones. You could give them access to specialists. You just imagine how much more powerful community health workers will be in the future with cloud. And of course, once your community health workers are strengthened, similarly primary care would be. And if you have primary care with access to specialists, so I don't look at this telehealth as a solution. It's more of having your frontline health workers access to things that before they don't have access to. Cloud computing can help them do that. Just also imagine how primary care would become embedded in our health systems in Southeast Asia and developing countries. We have all desired, but seldom see actually. So Sruthi, looking forward to an interesting panel.
Well, thank you so much, Eduardo. And also, I think that you've provided the perfect segue to my next question. So very much appreciated. I wondered if I could invite the panel to reflect a little bit on what was a very big theme in our report and has also been a big theme in what you've all mentioned to this point, which was health equity and the role that cloud plays in health equity and the potential for cloud and health equity. And while a lot of our discussion today will probably focus on what's to come, I wondered if any of you might be able to provide examples of particularly innovative things that you have seen, innovative solutions, cloud solutions that you have seen that have promoted health equity to date, just to bring this a little bit more to light. Would anybody like to go first, or should I just ask?
All right, I can share.
Thank you.
First of all, as a physician, one of the benefits of utilizing digitalization in healthcare, focusing on the cloud, is the uniformity of the EMR, electronic medical record. And for example, presently, each hospital may have a system. However, it's difficult to transfer the health information to other centers, not only other hospitals, other cities, other countries. And so one possible solution that has been ongoing is for the Department of Health or Ministry of Health in a country to select a particular electronic medical record that may be used nationwide. And for example, some countries would entertain 10 to 20 offers and try to select. And however, we have to keep in mind that in order for all citizens to be able to have a good access to use such EMR, then first, we've found that it should require low bandwidth in order to be accessible to areas in the country, far-flung, rural, for example, that do not have strong internet access. And one solution to that is the satellite internet system. Okay, a benefit once all areas can be given access, for example, as was already mentioned by some previous panelists, is that primary health care in different areas can also be able to access the benefits of specialists who are not in their region. And absolutely, training is required for the community, rural health community workers, from the use of accessing the system through the iPad, for example, cell phone. That doesn't have to be laptop because that definitely isn't available everywhere. I guess that's what I could share as for now, for our experience in trying to digitalize healthcare, in order to, in order to fulfill universal health coverage. Thank you.
That's a fabulous example. Thank you, Anton. I noticed before, Eduardo, if you would like to provide an example of innovation.
Thanks, Sruthi. Probably, I probably would not like to call it innovation. Probably it's more like data capture in the government system. Okay, so the private sector, they do private care providers, they capture data. But the government sector, if you go around countries or developing countries, most of the data is basically captured pen and paper. And if anything goes up, it's usually aggregated. So you seldom have the ability to look into data at the individual level. And most of the reports we hear from government health systems is aggregate data. Now we're seeing basically data captured at the individual level. Because in a sense, cloud now enables, and of course, not just cloud, the tools that we have now, the cell phones and all that, to capture this data. I don't want to call it DMR. For me, it's just simple data capture of all of the health events that's happening. And what have we seen now? Now see, in a sense, the ability for formal healthcare workers, let's say in the health center, working with the community health workers, sharing data among each other. Before, in order to refer, you need to write something, you talk something, lots of things lost in translation. Now you could actually, and I think Indonesia is going for that, develop an app where once data is captured, if the person is, all the health events in that person will be accessible from the community health workers all the way to the primary care physician in the puskesmas. You could just imagine in the future, it can go up. So similarly, this is the kind of discussion that we're seeing in the Philippines. We're also seeing this in Thailand. So for me, before, whenever this was discussed, this was proposed, people say, oh, it's expensive. We have to buy so many servers. How can we run the apps and all that? If you're offline, nothing happens. With cloud, you could do things offline, online. Data is captured, data analytics is rapid. So that's why I like the slide of Neil. Cloud is not a solution by itself; it's the unbelievable enabler. And so for me, if countries start looking at cloud as an enabling tool, then there's just so much we can do. And so, and I just talk in primary care. You have to stop me because I could talk other aspects, other parts of the health system where adoption of cloud computing could actually make a difference. I'll stop there.
Thank you so much, Eduardo. I mean, I think I'll move on to the next. Oh, Samin, did you want to add something quickly there?
I think one example that came to my mind was there are teleradiology solutions that have now been developed that are portable, that allow clinicians or healthcare workers in low resource settings where there might not only be an internet problem, but also there might be a lack of electricity. So they're like portable batteries, and they allow the sharing of radiology data. And they have physicians sitting in different countries who are helping people analyze these images, use AI support systems to help support decision making on those radiology diagnostics, and then provide care to people who would otherwise have not been able to get that kind of diagnosis or support. So there's startups like Alum Health who are working in this space, and this is all powered by the cloud. So it's quite interesting to see that these kind of solutions are now becoming more common, and it's bringing giving people access to services they would never have had otherwise.
I mean, that's a really wonderful example, and thank you so much for those examples of what has been. And I think that Eduardo, you said it's a powerful enabler, and I'm wondering if this is such a powerful enabler in a time when there is need for greater efficiency. I wonder what the panelists' thoughts are on why why, when Nick put up that slide about cloud adoption, and there was this sort of very low dot point of where healthcare is. What do you think that's about? Why do you believe that there has been such hesitancy in the healthcare industry's adoption of cloud?
Should probably start with Samin on that one.
Yes, I was just about to jump in. So earlier this year, we carried out a study on the barriers that are impeding cloud adoption in public healthcare. And we saw the three key barriers, if I get into that. The first barrier that we saw was that, I think Nick highlighted some of these items as well, but we saw that there is a widespread misperception that healthcare data is in the cloud would not be secure. And some of what is driving this is actually not having enough understanding about how cloud works. So we had, for example, one of our interviewees who is an advisor to MOH in Japan telling us that he had people from healthcare insurance companies coming to him and telling him, can you point out data to me? Can you point out where the healthcare data is stored? Can I see it? So there's this perception that if you can't see it, it's not secure. And then there are other factors driving it as well. Another barrier was, as Nick highlighted, was the resistance to change from healthcare management. And then this stems from a number of factors. There is this perception that if healthcare data that the organization shares, they would lose some of their power or some of their revenue. There are perceptions, of course, that moving from the capital expenditure model where they were outlaying investments at the outset of a new investment versus now the pay-as-you-go model would be too much of a shift. Or there could be other reasons, for example, the fear that there would be a loss of productivity among healthcare practitioners when they move to a different system. So these are some factors that led to organizational resistance to change. And then the third I would mention, and that kind of adds to the misperceptions around data security, is the lack of data regulations around data security and data privacy of healthcare data. So what we found was actually, so for our report, we looked at about 12 markets, and across these, we've seen some countries that already have healthcare data security and privacy regulations. There are countries who do not have these. For example, India, it's still in a draft state, the PDPA bill. And what's happened here is when there is no law, there is lesser confidence in these kinds of solutions. And in countries where the law exists, sometimes there is, it's ambiguous about the use of healthcare data and what kind of security regulations are applicable to the different kinds of healthcare data. And then in countries where healthcare data regulations are already present and maybe even well classified, for example, in Japan, our interviewees told us that the healthcare IT staff just do not have the confidence to apply those regulations to healthcare data. They don't understand because they haven't been given the training on how to apply those healthcare data set regulations or classifications to the healthcare data that they're dealing with on a day-to-day basis. So those are the three key barriers. There are more, but I'll stop there.
I mean, that is so clear. Thank you so much for outlining it that way. Eduardo, I wonder if you have anything to add.
Yeah, probably to add to Simin, right? What Simin was saying. So the privacy is a big issue in healthcare, and it's not just cloud, because healthcare information is so how do we call it, important. It can determine whether you get a job. It determine so many things in life. So the fear that health data that goes to the cloud is not going to be protected. This has been a deterrent. Now, of course, with blockchain and all that other data privacy laws that are coming out in countries, I think that will be addressed. So that may just be managed. I think there's a second one quite interesting. Is that and this is from a government perspective, how do they actually contract a cloud? It's a service, procurement is, IT procurement has always been complicated for countries, right? That's why even managed services is something lots of governments cannot contract with because they procure for what? They procure something, they procure a server, then that's easy for them to understand. Or they procure an app, and that's easy to understand. But if you procure a service in IT, that's not been, I think that's not been really been addressed in many government procurement rules. And until, I think this is where Amazon should be creative and start advising, and in a sense, how would you package this? How would you sell this to governments? Because if it's annually you have to procure, and every year you change your cloud from Amazon to Google or somebody else. So I think this has to be addressed. And sometimes, and my sense is when Amazon or other cloud providers talk to ministries of health, and not just ministries of health, but other government ministries, that's probably the deterrent that's stopping them to go into deals. They're not saying it because they just don't know how to contract cloud and other IT services. So as I said, the managed services is also something that's complicated for them. So hopefully this is something that's also, it's not just the technology that you're talking about. I think nobody in this room or in any government office now will tell you the cloud is bad. They are sold to cloud. They all do Facebook anyhow. Well, they are there. Everybody, when you go to meetings, everybody's using their phone. So everybody's comfortable, know the value of what cloud is. It's really how to get that into government processes and pay for it. That's really, nobody is giving an answer to that right.
Andrew, I wonder if you have any perspectives from Amazon.
Yeah, look, and I think those are really interesting points. And I think, obviously endorse all of the things that Samin says. These are the things that we see as well. I think what underlies a lot of it, and to Eduardo's points as well, is that there is a real lack of expertise in terms of cloud and digital in general, in healthcare in particular. So, I mean, these skills are at various levels across various different industry verticals and different countries, but healthcare is really underinvested in that. And I think a lot of the fear that comes with it comes from lack of understanding of what cloud is and how, how cloud can be utilized and how cloud can actually be implemented in ways which increases the security and increases the oversight of healthcare data. And that's not just at the technical level. So obviously there's a need for technical skills, but it's also at the executive level and at the, at the policy and political level. They kind of really, we need to find ways to upskill people's knowledge in those areas as well, so that when their teams come to them and say, look, we've got this solution that we can deliver, greater efficiencies and reach more people on cloud, that the instant reaction from those people is, I don't know what cloud is, so I'm scared of it, so let's walk away from it. So we really need to look at that level as well. I think the points on procurement are good. It's something that we find not just in healthcare, but that when you go from a capex model of expenditure to an opex model of expenditure, you need to think about that and plan for that. And there's certainly ways to address that, but we need to have those conversations between healthcare executives and those in the finance side, and how to use the procurement like that. And then the other thing is, I think in many cases there's a perception that cloud in particular is just about storage. And if you go out to procure just storage, that's what you're going to get. But if you think about, well, what else can cloud bring, and what else can we do in terms of digital health, by having a more sophisticated procurement methodology, then that's something worth looking at. And looking at things like, European Union has very much adopted this kind of meet most economically advantageous tender process, where you're looking at not just the cost of buying something up front, but what else does it contribute economically to your institution or to the economy. So I think those are things that are worth looking at in terms of the procurement space as well.
Thank you, Andrew. Anton, I noticed you came off mute. Was there something that you wanted to add to that question?
Yes, wonderful comments from all of the panelists. I would just like to add that in order for cloud to be able to be successfully adopted by the political leadership, it required a strong mandate from the citizenry, and awareness is definitely a concern. But aside from that, in order for the citizenry to be able to believe in the cloud, they must, as Samin mentioned, about the security, that the cloud would not be able to be disrupted, or the hackability of their health information, the use of the health information for what purposes, if only for their medical needs, but also for research. So for example, in Japan, there is an opt-out mechanism. In Taiwan, for example, citizenry is very, very not in favor of a general database for their health information. And so when we carry out the operations for cloud in each country, we have to also consider the sentiment of the citizens, because it will not be the same in every country. And I'm just speaking for Southeast Asia and East Asia alone. And so in other areas, regions of the world, cloud will have a different experience.
Maybe I could just follow up quickly on that one. And I think, this is another part of the, improving the understanding of what can be done in this space. I think there's multiple ways of architecting, solutions. You can build, huge monolithic databases of data, but you can also build federated systems where data sits in small local areas, but has connections, and you can provide consent controls for those kinds of things. So again, this is where we can kind of work to improve the level of understanding of, the multiple different ways in which you can deliver solutions.
I think that idea that it needs to be a consideration at the level of what is the sort of what are the preferences and norms of each of the respective citizenries of each of the areas that we're thinking of is a really interesting point. Thank you for raising that, Anton. I was thinking it would be helpful to have a little bit of a discussion about policy makers. And I think we've already sort of begun to touch on this. One of the comments from one of our attendees today is that in India, one of the ways organisations and companies closely work with government is by placing individuals as resources in the government offices. And I was wondering if panelists, you might be able to provide examples that you know of where some of the challenges that we have been speaking about have been overcome, specifically through approach to policymakers in adopting in cloud adoption in healthcare. Samin, if you don't mind, I might start with you once.
So I think Eduardo was mentioning the need for a mandate. Now, not every government will use that approach. So in the absence of mandates, I think there needs to be policy around what kind of incentive will drive the adoption. So in the US, we've had, for example, for supporting the adoption of electronic health records, there was the HITECH Act, which introduced incentives for physicians to adopt electronic health records, and that led to a significant rise in adoption. And I think related to the comment that from the audience, it's also when it comes to policy, there needs to be within policymakers a team of industry ICT experts. So, for example, the Malaysian Digital Economy Blueprint that actually outlines as part of its digital transformation strategy to bring in professional services talent as well as cybersecurity talent and groom them into policymakers. So what this will do is when you bring these people into policymakers, as policymakers, they can actually understand these, a particular issue, they can understand the implications, and they can drive and steer the digital transformation agenda. What I think some of the barriers, and as we've discussed, it's because of the lack of knowledge even at the policymaker level. So first of all, you need to bring in that kind of talent. Then you need to craft the kind of policies, for example, also around procurement, as was mentioned earlier. If there is no guidance from governments or policymakers on how adoption should take place, what are the minimum standards for a cloud services provider? What kind of procurement contracts are we looking at? What kind of guidance is there for a healthcare agency who has who's learning this new technology for the first time to actually adopt this particular solution. So policies need to cover procurement, policies need to cover talent, policies need to cover cybersecurity as well, data security, data privacy regulations where they're absent. That needs to be brought in. And then additionally, what we've seen is that the data exists, but it's not being shared because the data is all in different formats. So there needs to be policy driving the mandate for interoperability, which basically allows for healthcare data to be connected and shared. So policy changes are required urgently for the adoption of healthcare.
Thank you, Samin. I wonder if Eduardo, would you like to add to that?
Yeah, thanks, Shruti. I think okay. How would we enable? I think the question that they're asking is how do we enable cloud, right? So probably I think they're different. So one, of course, is what Andrew said. Okay? One is if capacity is actually lacking in health and understanding cloud and IT, that is something that can be responded to, right? So the if there's one thing the health sector is good at, the moment that the particular set of skills are identified as lacking, the health sector can produce that skill quite rapidly. So so probably it's there's some disconnect on what is really needed and how it should be taught. So if some people can sit down and start saying, okay, this is who shall we train? Shall we have a new set of doing this? Is it going to be nurses will be trained? Don't expect to train doctors. They're already in their old-fashioned ways. So, and I think the capacity is something government can plan, private sector can support. That can be done. The second, we talk about the privacy concerns. As I said, it's big in health. So this has to be repeated all over with repeated laws, even laws that are redundant. HIPAA in the States, we all know that, right? And so countries don't have that. They have broad data privacy laws. Probably we need a specific health data privacy laws just to assure everybody, the patients and all that. Third, the practice of medicine, healthcare is heavily regulated in lots of countries. And I think if there's one thing the pandemic gave us, it allowed some opening in telemedicine. But in a lot of countries, the pushback is happening because telemedicine is not actually defined as practice of medicine in lots of countries. So we need to build on these gains, the telemedicine, the online prescriptions. You don't have to see a pharmacy. You don't have to give the actual prescription. This is still how it's required. It's still what the law requires in so many countries. So we already know that telemed, telerad, a lot of these transaction between the healthcare provider and the patient, happened during the pandemic. It worked. Protections can happen. So this needs to be, the policies needs to be formalized because it can still be reversed once the pandemic settles down. And fourth, what Samin said, high-tech law, right? But more than that, what it's all about, it's the government of the United States government basically said they will pay for this. To either we will only pay if you're online, or we will incentivize. Now, what's the discussion in some other countries right now? The government health insurance system will not pay for telemed because they are designed to pay for actual face-to-face transactions, or they will not pay for your consultation, cardiac clearance online because they want to look at the paper it's written and signed. Now, the private sector, the private insurers are probably a bit ahead, but government rules very difficult because they say they may be audited by the internal auditor general, and they end up paying that will be disallowed in the future. So the payment mechanisms of government, whether it's a payment to the purchaser national insurance, whether it's procurement policies of government, should now be aligned so that it enables online transactions, the use of the cloud. Does it need a high-tech law similar to the US? That would be great. Or would it need some just adjustment, incremental revisions of some policies in countries? If that's the approach. So for me, these are the things that you need to do. Finally, I think the last one. It's also the story has to be told. Okay, How are doctors, how are health workers convinced to do new things? They like to be told stories over and over again. For medicines, med reps, fellow doctors, they're never-ending conventions talking to each other, right? Health workers love to have this. And so I think this is where our friends from Amazon, those who have been championing this, we need to have stories that are understood by doctors. Okay, sorry, Nick, but sometimes your presentation, I know, understand the cloud, but if I'm also a medical doctor, my medical doctor side got lost in your presentation, right? These are not the way you tell the story to health workers. So I think that would be a communication challenge. I'm looking at Simen, Access Health do this quite well. So you may want to start moving away from talking it's about research, it's about economic gains. That's the Ministry of Finance people. If talking to health people, tell it the way health people would understand. A baby was saved. A mother did not die, right? A stroke was managed because telemed or the use of the cloud facilitated immediate access to care. Those are the stories that needs to be told.
I'm totally with you, Eduardo. I think the point of telling stories actually came to my mind even before when Anton mentioned the point about citizens not wanting their healthcare data to be stored. I was thinking it's because that communication is missing, where they don't realize the benefits of sharing their data, because the research outcomes that could actually help them improve their own health, that story is missing. They haven't been told that story, and they need to be told that story so that they actually would volunteer their healthcare data, so that it's for the good of the whole, the citizenry, the country, global health. So I think that marketing piece needs to come in as well.
So if I could jump in and follow up those a little bit. So I think those are really good points, Eduardo. And I think what I think is really critical, you spoke about all of the different, levers of the reimbursement processes and the traditional models of delivering care and some of those challenges. And I think what is really important at the national policy level, or at least, the large, for India, for example, potentially it's at the state level, or for Australia, it's the state level, it might be at the national level, is to have a really strong digital health policy, to be really, specific about what you're trying to achieve and look at the whole ecosystem that goes around it. Because I think often what happens is that digital gets just added on top of the existing way of delivering care, which can be helpful, but it's not actually really transforming care. You need to build a strategy and then start building the infrastructure up from it. So to your last point about, bringing doctors along, to be fair to the Deloitte team, what I was really trying to do was make the economic case for why they should develop a digital health strategy. Maybe the next piece of work is to take it down to bring the doctors along with it.
Thank you. Thank you for those comments. And I think that, yes, I think that the storytelling is really is a really critical piece for this. And even this discussion here today is helping to sort of bring some of those things that we've been thinking about to light. I have a related question to the one we've just been speaking about from the audience that I might just raise at this point. And we've sort of spoken a little bit about this, but just wondering if you could answer the question of what competencies you believe government have to ensure that cloud technology is able to deliver the benefits with acceptable risks and available resources.
I'm happy for others to jump in, but I can have a first stab at that. So I think we talked a little bit about just having that general executive level IT knowledge and skills, so that when the teams come to them, they kind of know what they're talking about. Then it really, and that's at the procurement level as well. So you need to bring some people in with specific expertise at the procurement level so that they understand what they're purchasing. But I think the last part of that question there is, to deliver the benefits within acceptable risks and resources. And I think this is where, leveraging international experience, but also most importantly, international frameworks and standards around, using ISO standards, using existing frameworks. Now, HIPAA is for a different purpose and it's US only, but it does set out a really nice framework. UK has done a very nice job of setting up the framework for cloud in healthcare. Singapore's done a reasonably good job in some ways there, in terms of setting up some of the frameworks for that, and setting up at the government level, having panels of approved suppliers where you've already gone through that assessment process that can help healthcare institutions feel confident that the services they're procuring have been assessed and that meet some of those international standards. So those things I think are really helpful in helping to kind of guide how you set the governance standards and how you procure.
Thank you, Andrew. I think, Anton, I think I also saw you. Did you potentially come in to jump in there?
Well, that was an accident, but
Oh, sorry.
no, it's okay. I just, in ERIA, we work a lot with policymakers, and in terms of the cloud, yes, they need to be aware of what it's all about, understand it, its safety, its security, its cost efficiency. I was happy to hear in your presentation that about the large amount of savings over a period of, for example, 5 years for the healthcare industry in the country. For the policymakers, for government, they have to have a good awareness, connection with the citizenry. I know I kind of harped on that for a while, but that will have a big impact on the success on how the cloud, the digitalization of healthcare can be carried out. And second, since I do work with research, just want to mention about that the policymakers do base the recommendations on quality data from evidence-based studies that are productive, produce good quality, robust data, even surveys, for example, because that is a way to connect both the citizenry and evidence, and can be used over several periods of years. So perhaps your study will also be used by policymakers to implement the cloud.
Sruthi, if you allow me, okay. So the question is, what skills should government have, right? Interesting question. I think, but so in a sense, for countries now, their approach now is like to get all of the IT digital people and put them in one ministry, right? Then basically expect that these experts will take care of all of the other sectors, right? Whether it's education, health, and within the specific ministries, you don't. When you talk to them, sometimes they'll say, "We just refer to the Ministry of IT," and that will solve the problem. So that may not be an appropriate way, because you need to embed in every ministry that understanding of digital, understanding of cloud, and all that. And how can you do that? The way government usually do, either they create positions within government. That's now in the Ministry of Digital Health. They get the private sector, the Indian model. The private companies in India are great. They donate these experts. Okay, the government doesn't pay for them. That's why they're easy to embed in government agencies, because you don't have to do a hiring process and all of that. They usually are donated by of course, the very big Indian digital industry, which unfortunately is not present in other countries. Or you start developing courses and all that. Now going now into that, let's go specific to health. What do you need? So you may want to split it, right? You would need probably experts, technical experts, whom you will train both in health and digital. So whether you call it medical informatics courses and all that, that would be, and that's need to be expanded, because there's a lot of jobs there, right? Andrew and Amazon will probably hire a lot of them soon. Sorry, I'm just kidding, Andrew. But nonetheless, it's what really needs for me, intervention, massive investment, is to get the health workers sensitized. Okay, I don't know whether the curriculums right now in health even have something on digital, right? You would expect all the nurses who will graduate to capture data, to understand all of that, to explain data privacy when they've never been sensitized. Now we have a whole generation of young people who are studying, you don't really need to train those who are in the system, who are intuitive already. They're digital intuitive. So I think we need to have these courses, these topics added, right? And frankly, I would like to focus on the nurses because they're the one who, in the hospital, in the primary facility, they're the one who capture the data. It's the nurses, the midwives, the community health workers, right? The doctors will just give orders, right, and then disappear somewhere. So this is the cadre, the health workers that you need to become really digital intuitive in their work. And it will not be that difficult to include that in their training, right? And of course, the challenge now is to develop those materials. What will you train, right? Sometimes I'm so tempted, just make them use Facebook every day, right? All class discussions will be to Instagram. Sorry, there's not specific brand I'm endorsing, or something like that. But so it will just happen that when they get to their workplace, but it could really be formally designed. So that's the way I think developing countries can do this quite fast. And as I said, this is not something that takes, I'm sorry, unfortunately developing, you need like you have to wait for a strategy or a plan. Okay, we know when you need that takes years to make. I think now is really the time to just, the pandemic have shown that it worked. After you have so many user cases, just get the process moving, identify, this, some of the things we're talking about, the training of nurses, the training of other health workers who are the pharmacists. The pharmacists is very important. They capture a lot of things. The lab people, then things will just move ahead. And before you know it, this will be embedded in the health system. And because as we said, that in the cloud technology has moved so fast that these are just, it's plug and play for a lot of things. And
Eduardo, I really enjoyed the response of thinking about workforce-led and workforce-driven transformation. And Samin, you made a comment about this just a little bit earlier when we were talking about stories, and I wondered if perhaps you have any reflections or any other examples that you might add to that about the role of the workforce in cloud and healthcare.
I think definitely what happens is when healthcare practitioners find that the digital health solutions that they're now being asked to use are actually adding to their work instead of subtracting from it, there's so much pushback that healthcare management do not want to burden a physician who's already struggling to manage his or her workload with another, digital health solution. So I think when it comes to that, what's needed, along with the other courses that should be imparted to healthcare workers, is the design of the digital health solutions themselves. They have to be user-centered. They have to be designed keeping in mind the person who's going to use them. And they should be intuitive in the sense that you are already using that. Perhaps it's somehow embedded in the flow of the work that they're already doing. So it doesn't feel like an extra thing that they have to do, or it's more work for them. So, if you look at how payments got embedded into chat applications, for example, you've now become so used to it that you would just you could just go ahead and do something of that sort, or it's become that easy. So when it comes to these digital health applications, when it comes to the design, all of the stakeholders, the users, need to be involved right from the beginning. And there's a document from the guidelines from the UNDP on the 9 principles for digital design. So these kind of principles would actually help design a user-centered experience that is intuitive, easy to use, and basically will promote the collection and gathering of healthcare data more easily, just because the users themselves are open to using them. And of course, the healthcare management or even governments need to think about what kind of incentives would get these physicians to perhaps spend the time to, upskill, as well as spend the time to learn and invest that time in putting in that healthcare, additional work that they have to do with these digital health applications.
I totally agree that, it's incumbent upon those who are developing, at the clinical workforce level, it's totally incumbent upon those who are developing, digital health solutions to be thinking about how can I make a clinician's life easier? How can I let them operate at the top of their license rather than have their time taken by administrative, matters or adding additional burden to it? So that's something that industry really needs to take on board and really think about in terms of developing solutions. Is how can we free up the administrative burden from clinical practice? How can we make their life easier? How can we give them more time to spend with patients rather than on administrative tasks? And that's where we'll really bring a clinical workforce along with us. We can probably more easily bring finance people along with us if we can show savings, and we can probably bring public health officials along with us if we can show the benefits of big data and the insights you can get from big data. But when we want the clinical workforce along with us, we need to make their lives easier. And that's very doable, but it has to be consciously thought of.
Anton, did you want to add something there?
Okay. Yes, adding to both of the comments, in our experience, it's been very difficult, for example, in adopting one platform and then technology advances and then having to choose another platform and then another and another. So one word I'd like to introduce is the flexibility of the platform. So we do appreciate very much when a platform can add a new option and another option and another option in order to not have to purchase an entirely new platform, and also not have to retrain over and over with new platforms. So that's just a comment. And I agree that participative designing must be there, because even with ourselves, we have to consider now, we call patient-centered thinking. So perhaps the cloud and the platforms that use the cloud can think of the healthcare sector thinking as well. But most importantly, the flexibility, because that does also entail an enormous amount of costs over and over. Thank you.
Thank you, Anton. I think that what's beautiful about this discussion is that we've covered a number of perspectives. I think we've covered the perspective of policymakers, and we've got citizens, finances, and then now also workforce. One final perspective I was wondering if the panelists could provide their thoughts on the role of the private sector. So I think we've sort of spoken about policymakers, and I wonder if might invite comment on what panelists believe is the role of the private sector in accelerating the adoption of cloud in healthcare.
I can take that. Just stab at it would be that I think the private sector tends to be more innovative and tends to usually have more runway when it comes to trying out new digital health solutions. When Eduardo was speaking about primary care and how cloud can make a difference there, I was thinking about Reach 52, which is a startup here. I think people in Singapore would recognize. That's working in about 7 different countries in Southeast Asia, as well as I believe now they've moved to Africa as well, where they've had digital health, an app that works offline, and community health workers who are now working with communities that have actually no access to a doctor are now helping track their healthcare data, screen them for chronic diseases, which are as Nick mentioned, are a huge problem in Southeast Asia right now, and helping them stay on top of that and helping them get the early diagnosis that they need, And this, for example, if it comes to diabetes, this can help them avoid irreversible complications. It could be amputation, it could be maybe the loss of sight. So there's a big role that's being played by the private sector, and I think they can set the example for the governments to follow, or show them exactly how the use cases of cloud or digital health technologies are there, so that they can follow suit.
Sruthi. Hi. So the private sector, of course, we know that the technology comes from the private sector, right? They'll be the one that I don't think there's trying to think whether there's a government run cloud somewhere, probably, but in a sense, the private sector, as we always know it to be nimble, we always innovative. We all know the fact that it responds to market means that it can adjust it. Yeah, I don't want to word again. It's disruptive and all that, and you need that. And that's one role of the private sector, right? Government, by its nature, has to be conservative. It can't be disruptive running government. So the private sector provides that that disruption in society, and so they need to be able to provide answers to government problems, and that's what the private sector should be doing. Now, of course, the challenge is that the private sector is also a huge chaotic world, right? So that sometimes when the government deals with them, they don't know. So I think I remember when the cloud came out, I started, when cloud became a buzzword, I was still in government. I think so many people came to me that they were cloud experts, right? Keep on asking them whether they were Cumulus, Nimbus, or whatever cloud. I was having fun with it, but that's the problem. With new technology, there'll be a lot of Tom, Dick, and Harrys that will go to government, and government will get confused and eventually become risk averse because they're just going to be swamped with so many proposals. So I think getting the private sector to work well within the private sector, the market sometimes is the way in which you weed out those who should not be there. But if the private sector could be a little bit more proactive, so that when they engage government, there will be less risk for government. There's already a process of vetting within the private sector, so that we know the government will be comfortable who are the good guys. Then I think that would facilitate lots of things, including public-private partnership. The government would simply basically partner with the private sector to do what they're doing because they're quite comfortable with it. I think that's one of the second of the private sector. I think in health in particular. Remember, in health we talk about universal health coverage, and I've always, whenever I talk with private sector people, I always tell them, look, you can be innovative, but please be aligned with the objective of universal health coverage, which is to minimize the out-of-pocket costs of patients. So if you do come out with your business model and it's designed to disrupt efforts by government to do that, or the revenue model is simply charge the patient whatever they want. It's not good, right? Because then you create inequity. You make the world more inequitable. Because at the end, what will that result? Telemedicine only for those who can pay? That's not good. So in a sense, probably a call on private sector who are listening here, that you can be innovative, but please make sure it's aligned with UHC, which is to lessen really the out-of-pocket costs, the financial risk of people whenever they get sick. Now you could argue, well, it's better to get access to services. Well, that you can do that without charging an arm, a leg, and a head from patients. But of course, the private sector do this even outside of telehealth or the cloud. But that's another discussion from another day. So that's how I see the part. Keep on innovating, but please be nice to the government, and please be aligned with government objectives, global objectives. And UHC is a global objective.
Yeah. And to that point, Eduardo, I mean, I think, at AWS, we have a principle called working backwards from the customer. And it's something that we actually spend a lot of time. We got quite a methodology around it. We spend a lot of time with our customers, talking to them about how you do that. And to your point, look at what the challenge is, look at what government is trying to solve, look what the public sector is trying to solve, and work backwards from that.
Okay, I just like to add that private sector provides friendly competition to improve user friendliness, comprehensiveness, cost efficiency, security, and for a multinational, for example, like Amazon, one thing that we have experienced in our region is that it's very, very helpful if the large private sector company organization can partner with a local in the country that they're trying to establish in, that can provide not only direct lines to customization, to the culture, to how to implement more effectively in that particular country, but also a note that the local partner should or must be one that is certified or approved by the national government, and in that way, there will be connection to the government.
Thank you very much for those thoughtful comments. And I think that sort of wraps the whole ecosystem up very nicely for this discussion. I believe we're at time, and so I'm going to thank our panelists for their contributions and thoughts today, and thank our audience for listening. I don't believe there are any further, Manny, would you like to add anything further before we wrap up the session today?
Not really, Sruthi. Thank you very much for your excellent moderation, and thank you to all the panelists for a very enriching discussion. Just to mention that this is the second of our policy webinar series. We do intend to have other sessions upcoming in the next year as well. So the next one will likely focus on financial inclusion, and we'll send out the details as usual ahead of time. So thank you very much for everyone for participating today. Have a good day.
Thank you.